So typically, the time at which we start to offer surgical treatment for abdominal aortic aneurysms is when we think the risk of it bursting is greater than the risk of the surgical repair. And what we've identified from previous trials is that you are safe to leave your aneurysm until it's 5.5 centimeters in diameter. After it exceeds this diameter, the risk of it bursting goes up really almost exponentially from 5.5, even more at 6, even more at 7, even more at 8. And therefore, we, on balance, offer surgical repair once it's 5.5 centimeters in diameter. So there are two types of aneurysm repair. The first is the traditional open aortic aneurysm repair. And what we mean by that is we open up the abdomen. So it requires a big cut inside your tummy. We then get to the aneurysm and we fix it from the inside. The second type of repair is the newer type, which we call keyhole or endovascular. In this procedure, we feed a stent from your groin up to your abdomen, your tummy, and then open up the device so that it covers it from the inside. A bit like the similar kind of stents that the cardiologists do for the heart. And this is a keyhole repair and is appropriate for about somewhere between about 70 and 80% of patients. So if you compare the two types of repair, keyhole and open or traditional, this has been studied extensively in trials. There is no doubt that if you have a keyhole repair, you have a much quicker recovery. Typically, for my patients, I would send them home the next day. And they're pretty much back to normal within a week or two. On the other hand, if you have an open repair, you're usually in a critical care for 24 to 48 hours. You're in hospital for about a week or two, and you really don't recover back to your baseline for anywhere between 3 and 6 months. The other aspect that's different between the two is in the short term, keyhole repair has a lower risk of major complications, including death. So typically, a keyhole repair maybe has a 1% mortality, whereas the open repair has somewhere between 2 and 5%. However, in the medium to long term, because the open repair is a stitched-in repair, it has more durability, i.e. it lasts longer. Whereas with a keyhole repair, you have to keep on being monitored, and some patients need further treatment and further intervention. So that if you look over a period of somewhere between 2 and 5 years, there's no difference in the mortality between the two types of repair. So in general, if you're younger and fitter, we would probably recommend the open repair because it's likely to last you longer. So there's no doubt that aneurysm surgery is big surgery. Even the keyhole repair has about a 1% risk of death. Furthermore, there are other complications, including problems in the groin where we access the blood vessels. There's risks using contrast for damage to the kidneys, which in the worst case scenario could require dialysis, although that's very rare. And then there are other complications from the repair in the medium to long term requiring further procedures. Open surgery has no doubt a higher risk of major complications in the early period, and that includes things like heart attacks, chest infections, and associated with that, therefore, is the risk of death, which we would quote at about 2%, and maybe slightly more if you're less fit. Because it's a stitched-in repair, the chances of longer-term complications with repair are less, but you can get abdominal complications. For example, sometimes bowel can get stuck to each other, which we call adhesions, and you can develop a hernia in your wound incision site, typically around a year or later. So if you have a keyhole repair, you're likely to recover fairly quickly. These days, certainly in my practice, I do it percutaneous. So I only make about a 1 or 2 centimeter cut in the groin on each side. You usually are home the next day. And by and large, your wounds are healed within a week or two. You're back to normal within that period of time. And you usually carry on with life as if very little happened. Of course, you then need to come back for regular scans to make sure everything's intact. And depending on whether they show anything or not, you may have further procedures. This is very different to if you have open repair. If you have open repair, you're obviously in critical care and then in hospital for about a week or two. You can have some problems with eating and drinking afterwards. And no doubt, because it's a big incision, a big cut in your tummy, then it does take some time to recover. Typically, I tell my patients that you will not get back to where you were the day before surgery for 3 to 6 months. So you can take some time to get back to your normal levels of activity, walking, or anything more physical that you enjoy, whether that's dancing or sport.